It's me a great pleasure to welcome you to the 2020 Chalmers Oration. Jonathan Craig's my name. I'm the Vice President Executive Dean of the College of Medicine and Public Health, and as you know, this is really a very exciting landmark event for the college and the university more generally, and we're delighted to have such a distinguished speaker, Professor Nicola Spurrier, who's about to speak on a topic of her choice. Now, before we go further, we just want to acknowledge very importantly that here on the Adelaide Plains, we're on the traditional lands of the Kaurna people, and we want to pay our respects to traditional custodians and elders past, present and emerging, but also note that Flinders has a very large footprint across South Australia and into the Northern Territory, and a number of people online, over 500 plus, will be on the traditional lands of many of these traditional custodians, and we want to acknowledge the very deep cultural and spiritual significance with which the traditional custodians hold that dear. And this is represented in this slide, which demonstrates the lands on which Flinders teaches, research and operates. This oration is in memory is not the right word, because John, thankfully, and we are very thankful that John and his wife Alex are here with us. This is an oration which commemorates the work of John Chalmers, who, as you'll see here, was the first professor of medicine, and here for 21 years, where he had a profound impact upon not only the university, but how care was delivered at Flinders Medical Centre. He had a major influence on the development of the medical school, major teaching hospitals such as the Flinders Medical Centre, and affectionately what is known as the REPAT. And we are very honoured to have John and his family joining us in tonight's audience. We're also very delighted, as well as the 500 plus who are online, to welcome Professor Sue O'Neill, who's the Chief Executive Officer of the Southern Adelaide Local Health Network, and this partnership is as robust and strong as it was when John was here. We're also very excited to have Dr. Fiona Harris, who's an alumnus of this university, and her husband, Richard Harris, who's 2019 Australian of the Year, and you might forgive me for just reverting the order to demonstrate that everyone makes an important contribution. We're also very grateful that Professor Claire Pollock, Senior Deputy Vice-Chancellor Students, is here representing the Vice-Chancellor. Thank you, Claire, and indeed so many of you, colleagues, staff and students from the university and the South Adelaide Local Health Network, and it's good to see many of the board of that august institution here with us. The Chalmers orators, you can see, it's a very long and luminous list, and this is by no means to put pressure on Nicola, but just to say that in 2018, Professor Sir Peter Radcliffe gave this lecture, and not long after he received the Nobel Prize. And whether it was causally related or one of those things, who knows? And then I'm sure those of you who were with us last year, when you heard Professor Alex Brown speak about Indigenous health, will still have his voice ringing in your ear in a very positive way. So tonight's format is a little bit different, because as you would have noticed, the world is a little bit of a different place than what it was this time last year. We'll be running till 7:15. Following the oration, there will be an opportunity for questions. Thank you, Nicola, for allowing that to happen. For those in the room, there are a couple of microphones in each aisle. Please come to those microphones. because we want everybody to hear your questions both in the room and online. And for those joining online, please select Ask a Question via your Microsoft Teams live screen, and I'll read those questions out and Nicola will ask them in real time, which we're very grateful. So, Nicola Spurrier, we thank you so much for coming again. We want to acknowledge the contribution that you have made to South Australia and Australians' health system more generally. You can see Nicola's credentials there listed, but I want to highlight a couple of other things. So she is a dual qualified medical specialist, she's a real card-carrying public health physician. You'd appreciate there's a lot of others who have their voices, but she's a public health physician and paediatrician with 30 years experience within SA Health. She's specialised in developing and implementing policies and programs across a very broad range of areas, including child health, obesity prevention, and Aboriginal health. As you know, she also has extensive experience in health protection and promotion, public health partnership and health diplomacy activities. And in April this year, the university awarded her academic status at the level of professor. So please join me in welcoming Professor Nicola Spurrier to the podium.
Thank you very much. It is indeed an honour, and I am so thrilled to be here because I have worked at Flinders and I had such a wonderful time here for over 10 years working at the hospital and teaching medical students. And it has just been fabulous tonight to meet John and Alex. It was always terrific teaching at this medical school with the postgraduate students and having this problem-based learning, this new way of teaching here. And I think it really is a credit to John and the first people that set up this medical school to have it such an innovative model, and it was a wonderful place to start off myself as a consultant here. It's always good in Adelaide because wherever you go, you know everyone, and I'm looking straight here at Andy, who I cycle with, and you know, it's lovely, and it's lovely to have my mum here tonight and my sister Justine and brother-in-law Benoit. So I always feel amongst friends in South Australia. So anyway, it has been a very interesting year for me and my team. So this is a talk that, in fact, I think, Jonathan, you may have suggested this topic, and I was umming and ahhing and said, Jonathan, the leadership bit may be a bit difficult to, you know, I'm trying to work out how I can wind it in, but hopefully I can do that justice and just give you a few insights into the experiences I've had this year. And just before I begin, I also would like to acknowledge that we are here on Kaurna land, and also to acknowledge that there may be Aboriginal people watching tonight, and also thank you very much for attending this evening. So let's proceed. So I'm thinking about leadership, and Jonathan, I went through my slides and my photos on my phone, and I was thinking, what is leadership about? And I had this picture of Napoleon Bonaparte that I'd taken when I was in Vienna, in those times, a long time ago, when you could travel, in fact. And some of these sorts of words came to me, and I am putting these down because actually that's not what it's like in public health. I can tell you what, I am not completely knowledgeable, infallible and wise. I don't know everything, and I'm looking here at Chris Bagley because he knows I ring him up from time to time and ask his advice. But this is the sort of thing that often we may not have written, but we think about in terms of leaders being powerful, knowledgeable, heroic, wise, infallible, skilled, perhaps not dominating, certainly confident, visionary, decisive and courageous. And certainly some of the things that I've had to face this year, I have had to be brave, and I've had to say, look, I'm thinking about the well-being and the health of the South Australian population, and therefore this is going to be my advice. But there's much more to leadership in public health. So one of the people that I think about in terms of public health leadership is this wonderful person, Fiona Stanley. And Fiona is the reason I started my career in public health. As a paediatric registrar, Fiona came and spoke to a group of registrars and talked to us about evidence-based medicine. And back in those days, before the internet, we didn't have evidence-based medicine. We went and read books, but often the books were out of date, and we talked to our learned colleagues about what we should be doing with patients. But Fiona came in and said, actually, there's this thing called evidence-based medicine, and I'm going to show you how to critically analyse this paper. And that was a real turning point for me. And I particularly like this painting. I don't know if you've been to the National Portrait Gallery in Canberra, but this is where this portrait hangs. And I was reading the artist's description of this portrait. And in fact, she said, Fiona said to her, I do not want this portrait to show all about how great I am, because that's not what public health is about. And instead, you can see that Fiona has her positioning slightly to the side with opening hands, and she's explaining things. You can see her talking, and you can see her looking at you and trying to get you on board. She's doing public health diplomacy. She's trying to convince you that there is a problem that needs to be fixed, and if we all work together, we will be able to fix it, because public health is about partnerships. And the other lovely thing about this photograph is that Fiona has stepped out of that light. You see the limelight behind her. She stepped out of the limelight. In fact, she's coming towards you. She's offering, you know, her hand out. Let's be friends. Let's do this together. So that's the sort of person I aspire to in terms of my public health leadership. Now, the other thing about public health crises is they're usually slow burns. Now, actually, in my job, I also have roles, if there's a bushfire, which is obviously quite a fast burn, and other emergencies, but often public health crises are slow burns. And public health people, we believe obesity is a crisis, okay, because it's killing large numbers of people, and it is preventable. Chronic disease, the very high rates of diabetes that we have in our community. And that's really brought to life with COVID, when people with COVID obviously have run into more problems. The social inequalities in health, there's the pandemics, and this is a slow burn. So I've been going 7 months. I can't see an end in sight, okay? It's not just over quickly. Climate change, that's a real slow burn, unfortunately, and we need to be doing things about it. And then you've got drugs of dependence and tobacco and alcohol. Again, these are all crises to me as a public health physician, but they take a long time, and they don't need a general on a charger going in there quickly, sorting things out, and then getting out again. It's a different sort of leadership that's required. So what I'm going to do from a COVID perspective is a little bit of looking back and talk to you about some of the key strategies and decisions that I've been involved with, but also looking at that through the lens of public health principles. And then, because my topic was suggested, to look at what are we going to learn about the COVID world, sort of post-COVID. What can we learn, and what might we not want to lose? Now, I'm not going to give you a talk about epidemiology and all of our case numbers, anything like that, but I do want to just have this slide here just to set the scene that if you haven't realised, we have done incredibly well in Australia. We are very, very lucky. Those are the number of deaths in the US, and of course that will be updated on a daily basis. 200,000 people. Now I know it's a really large population, but 200,000, I've just been to the Northern Territory, that's almost everybody in the Northern Territory dying from COVID. And we have got, you know, these very significant deaths here in Australia as well, unfortunately, because of the impact on aged care in Victoria. But in South Australia, we've only had 4 deaths. It's quite a different experience here. So what is it? You know, how did we get here? Why is it that we were so lucky? So I'm going to talk through some of those issues, and some of you already know. So first up, I also want to ground this in this sort of thinking of COVID. And as human beings, if you think back to 12 months ago, I would be the same. You kind of knew about pandemics, but you would have no idea that we could be in such a situation where we have no international travel, we've shut our borders. It's quite unbelievable. And the first step for us, in fact, in Australia, was really a wake-up that this could happen. And so I've put a little picture here of the plague, and I've got a few quotes from this little book, and many of you will have read it, perhaps at school. If you are particularly clever, you may have read it in French, because Albert Camus is French. That wasn't the case for me. I read the English version. But reading it this year, it was a little bit like my life was happening, and it was actually quite instructive. But the first thing is believing the unbelievable. So in this book, and I'll just give you a little quote, our fellow citizens had never thought that our little town might be a place particularly chosen as one where rats die in the sun and concierge perish from peculiar illnesses. From this point of view, indeed, they were mistaken and discovered that they had to adjust their ideas. So this is a little town of Oran, sort of set somewhere in France, and the plague came to them in the 1940s. And then even after Dr. Ryu had acknowledged to his friend that a handful of sick people in different places had unexpectedly died of plague, the danger seemed unreal. This is me in January, really? The danger seemed unreal to him. It is just that when one is a doctor, one has acquired some idea of pain, so you kind of get that people can die. And he had gained a little more imagination, so he started thinking maybe something's going wrong in this town when these rats started dying, and he was absolutely right. But that was how we were feeling in January, because we could see what was happening in China, but we hadn't really, at least I hadn't, anticipated the enormity of this pandemic. Until we were very lucky to have a presentation from Dr. Bruce Aylward. And I don't know if any of you have looked up or heard any of the speeches or presentations that Bruce has given. But as a member of AHPPC, we were very lucky early on to have Bruce talk to us over a video conference. And he had been to China. He's part of the WHO contingent, and he'd been to China, and it was to review the way the epidemic had unfolded in China and what the Chinese people had done to contain it. And one of the things that really struck me was when he told me, I have such a sore throat coming back, because everywhere I go, we are staying 1.5 to 2 metres away from each other, and so we're having to talk really loudly, and I got such a sore throat by the end of every day. And it seemed a very kind of strange thing to be told at the time. And the other thing that I particularly remember him saying was, don't underestimate Chinese people in terms of their medical expertise. The reason why there were not larger number of people dying in China was because they had such high levels of medical care. You know, they were building individual hospitals to cope with this. And what he also said was people were saying their motto was, we will save lives, we will save lives. And everything that they were doing, all of the building of new hospitals was all about saving lives. So that was a big wake-up call for Australia. And at that time, we'd only had a handful of cases. And that was the beginning of us recommending to government that we needed to stop the flow. So my team in a communicable disease was, we're getting these cases, what are we doing? And, and we're looking at the hospitals, have we got enough beds? We've got Evan Everest wandering around, where are all the ventilators? Where are all the masks? This really was an important wake-up call, particularly I felt for myself, but possibly for some of the other chief health officers. So one of the things I wanted to also talk about was being a public health physician, because I know that there are many clinical people here, and it is a different perspective. And so how do you just keep your mind focused on the job? And this is a photograph of my view out of my office in Hindmarsh Square. And if you can pick up right over, I can almost see out to the sea because they haven't built buildings completely over that space. And I can look down into Rundle Mall. And when I look out and when I'm thinking, and I need to take time out to think about strategies and what aims and how we're going to get to where we need to get to, I can look out there and I'm thinking about the South Australian population actually, and I'm thinking about all the people that live out there and their kids and their families and what they do on a day-to-day basis, and it's very grounding. And I can also, as you can see, look into Rundle Mall, and Brendan Murphy used to joke with me about the Rundle Mall Index, because I'd say, look, there are not many people out here in South Australia during the lockdown, and then as things increased and we lifted those restrictions, I could see more people. So public health medicine, it is about people, and it's about whole populations of people. And so when if I'm trying to explain to people that what it is you do as a public health physician, I use the analogy of clinical medicine. So when you're a clinician, you're talking and taking a history and examining an individual patient. But for me as a public health physician, I'm actually having to take a history and look at the symptoms from a whole population. And that's the epidemiology and the data and the research. And then as a doctor with an individual patient, you might do some investigations. So then I might do the same thing from a public health perspective, is get some more data to look at what is causing a problem and perhaps do some research. And then we might put an intervention in place. And so for a public health physician, that intervention might be immunisation, or it might be quarantine, or it might be a health promotion or change of policy and the like. But I think the thing that is perhaps behind the reason I've been able to maintain this momentum is that I have this focus when I get up in the morning about the health of the population, because there's a lot of politics in this game, and there's a lot of noise, and there's a lot of other distractions. We've got other people like the Hotels Association, like various other lobby groups, and you do need to keep focused. And I absolutely love the fact that I can look out the window and think about the health of the population. The other thing that I've found really useful in my job, and again thinking about this from a leadership perspective, is we've got these sound public health principles. And unlike many people's jobs, I've got this job where I've got a whole act to follow. So it's the Public Health Act 2011, and these principles are written at the beginning of this act. Now I'm very lucky that Stephen Chrisley and Kevin Buckett put this act together, and that they've got these principles in there. And I just thought I'd step through those with you, because it explains why you have to have a particular leadership style in public health. And for those people who do know a bit of history, that's the Broad Street pump that John Snow took the handle off because of cholera epidemic in London. And he didn't know about cholera, but he could work out that the water was causing the problem. And so rather than just tell people, look, don't drink that water, or, you know, boil it once you've done it, or once you've got cholera, go to the nearest hospital because they've got great services there, okay? What he did was he went to the root of the problem and he took the handle off the pump. And so that's the sort of thing we try and do in public health. It can be pretty basic, but if you start at the root of the problem, then you can prevent a whole lot of people getting sick. So just working through these principles, the precautionary principle is an important one because I talked about evidence-based medicine, but in public health, precautionary is when if there's a perceived risk to public health, even if you've got a lack of full scientific certainty, you shouldn't use that as a reason for not going in and doing something. Now that's really important in a pandemic with a novel virus because you don't know much about this virus, so you really have to be using this precautionary principle. So I'm using that on a daily basis, making assessments of risk. You know, we've lifted some restrictions today. I've had to weigh that up with the fact that we've got a lot of people coming from New South Wales, pleased that John came and Alex, and that their disease and their cases have been down, but that's the precautionary principle. The next is being proportionate. And that's about the fact that if you're going to take some regulatory measures, you've got to minimise adverse impacts on business and members of the community. So that should be, you know, it really is this is a good example with the pandemic, is when we put those restrictions on, it was so hard for businesses, okay? So look at what's happening in Melbourne, unfortunately. We know that JobKeeper is going to wind back, and I think is almost sort of lifting on Monday. And there's going to be people that, and there's going to be businesses that won't be able to continue in South Australia. So every decision that I'm involved with making, we have to be looking at whether it's proportionate to the risk. And sustainability principle. That you're looking at public health, social, economic and environmental factors when you're making these decisions. The principle of prevention. So public health is about looking at public health risks that can be prevented and avoided so that you're preventing people getting disease. And I'm looking straight here at Sue. You'd love it if we prevented people coming through to your health service, wouldn't you? Yes. Well, as people know, the COVID pandemic absolutely solved ramping. We had no ramping for months, correct? Yes. Excellent. The other is having a population focus, and I've talked about that health of the whole population. Now that might mean that some individuals are inconvenienced in your population, but if you're thinking about the good of the whole population. The participation principle is about the fact that individuals and communities are going to be encouraged to participate in the way that you're putting things in place. And the partnership principle, I'm going to say a little bit more about that. But when you are improving the health of the whole population, one person cannot do it. So unless you have made lots of networks and, like Fiona Stanley, have lots of partnerships and get lots of people on board, then you're not going to be successful. And the last one is equity, to make sure that there is equity between people in terms of outcomes. So in the pandemic, we were very keen to make sure that we were communicating well with our culturally and linguistically diverse populations, our Aboriginal communities, and also, of course, aged care and disability care, because those were some of those vulnerable populations. So this sums up a little bit about public health, Paddy Phillips actually sent me this one, and I'm a little bit far away, but it does say, this is, and I love Pooh and Piglet, and Piglet's saying, but how will we know if our pandemic preparedness plan is successful, or pandemic plan is successful, says Piglet. And Pooh says, the world will think we overreacted. And Piglet says, so when we're right, they'll think we're wrong. And Pooh says, welcome to public health. So you can see we have a dilemma here. I want to do all these things and get people to change their behaviour to prevent X, Y and Z happening. But then X, Y and Z doesn't happen and they say you've overreacted. So the police commissioner and I often have a chuckle and we say that, you know, we've been so successful, what's the saying? We're of our own success. We're the victim, sorry, thank you very much. We're the victim of our own success here in South Australia. So now we have people, you know, not wanting to social distance and what are these restrictions happening and why aren't we dancing at weddings and such like. So you get my gist. The other thing about public health, and I showed you that with Fiona Stanley because she's wanting to get people in and to talk to them, is that this is absolutely a team effort. So it's not just me. I happen to be the one that's been given the privilege and honour of coming to talk to you tonight, but there are so many people that help me out on a daily basis. And so you've got the wonderful Chris McGowan, my boss and our CE, and then I've got this group of deputies, and the deputy at the side who's talking, he's obviously doing his media, is Mike Cusack, Dr. Mike Cusack. We nicked him from Northern Adelaide. He's an EDMS from there, and he was away today, so I couldn't get him in the photo. The tall guy with the beard behind me is Dr. Chris Leese. He heads up one of my divisions in the department. He is the best partnership networking person I've come across. He is fabulous. And then I've got Emily Kirkpatrick at the front. She's a GP, has been fantastic having her on board because partnering with GPs is so important. And there's Dr. Evan Everest, your own Dr. Evan Everest from ICU at Flinders. There's always funny stories with this pandemic, but we finally found out where some of the masks had gone, Sue, when Evan went up to have a look at his office at ICU, opened the door and it was stockpiled full of masks. So we knew they were somewhere. The other team that I want to give a big tick to, and it is actually the reason, other than those international and state borders, that we are in such a good place in South Australia, is SA Pathology. And that's Dr. Tom Dodd and Jeff Higgins. And Jeff is a bit of a hoarder. And what he did was, when they updated their equipment and went on to kind of automated PCR testing, is that he put all the old machines away in the bottom of the IMVS. And he knew that there was going to be a pandemic. So he was anticipating a pandemic. That was wonderful foresight. And so indeed, when we needed to ramp the testing up, he pulled everything out of the cupboard and set it all up. And it is fairly labour intensive and it has a slightly longer turnaround time. But what's happened is there's been short supplies of some reagents and that happens from time to time, and Jeff just goes back and everything runs. And this is the reason why we went from only, you know, a couple of tests a day up to thousands and thousands, and we've been able to continue to ramp up. Hoarding, you shouldn't be keeping things in your shed, guys. My husband, it's actually probably the cause of a pandemic, what is in his shed. But in certain circumstances, hoarding pays off. So I just wanted to say, from a team's point of view, if we didn't have SA Pathology, we wouldn't be in the way we are today. Because when we started testing, of course, we knew that we were doing population surveillance. Every time a respiratory swab was taken from anybody in South Australia, Tom had the PCR being done for COVID. I didn't actually know. He told me later, and I'm like, oh, this is fantastic. So this is the sort of way we work in South Australia, knowing each other and just getting on and doing a good job. So this is also a turning point for us, was closing the international and state borders. And I'm looking here at Chris Bagley because he'll remember those conversations. And I'd written my little plan on the back of an envelope the night before. And I did need to talk to some highly intelligent people like Chris and Paddy Phillips about our state borders. But again, another nice quote from the plague is one of the most remarkable consequences of the closing of the gates was indeed a sudden separation of people who were not prepared for it. Mothers and children, wives, husbands and lovers found themselves abruptly and irremediably divided, prevented from meeting. And that's my life at the moment, is sitting on this exemption committee and looking at all the requests for people to come to South Australia from Victoria, and it is quite heartbreaking. And it's something that you would never be expecting to do. But it is, again, believing the unbelievable. But it is the reason that we have been so successful in Australia and probably in South Australia as well. Though I'm really looking forward to the day when we can go back to not having those borders in place. The other thing that I think stood us in good stead was this ability to maintain public confidence. And this wasn't an idea that I had, actually. It was an idea that my CE, Chris McGowan, had. And it was one of the pillars initially. So we had flatten the curve, maintain public confidence, and get our health system up and ready. And so the maintaining public confidence has been really part of that team of myself, the Police Commissioner, Stephen Wade, our Minister, and the Premier. And we have tried to have that consistency because if you don't have that confidence of the public in what you are telling them, you're not going to be able to win in a pandemic, because again, it's all about population. It's all about, remember Fiona Stanley, explaining to people, asking, can you get on board with this? Do you understand what we all need to do? If we can do it together, we'll be successful. So I think that has been really important, and it's tiring because of course I have to do a lot of media and face the media, but that is so much a part of my work. It's such an important part of my work. Same as a surgeon. You know, someone said, oh, don't you feel nervous going and doing the media all the time? Well, I'm thinking if I was a surgeon and felt nervous every time I went and operated, it wouldn't work very well, would it? So, no, you know, you kind of just get used to it. But it's not always easy. You can see that it's not much of a trigger to shake public confidence. So we've got here, you might remember there was an email issue, Stephen Marshall admits public confidence in SA Health has taken a hit. And then I had another bit of a doozy last week with who, why, when, how, 12 questions on port family exemptions that SA Health must answer. So, you know, there's always going to be these ups and downs, but that's one of the reasons why I've been, you know, as part of my job, been out there talking to the public. It's just so important. So a little bit more about that importance of communication and what we've done in SA Health. I've got that lovely picture of me up at 2KW enjoying my cocktail. If you haven't had one, it is quite delicious. And there's why I wanted to show you the photo was not so much the cocktail, but that's Claire Hammond. She hates me calling her my media mum because it's too ageing for her. So, but anyway, you really have to have somebody supporting you all the time from a media perspective. And I just wanted to have a bit of a shout out for the great team we've got. There's a couple of the social media posts. We are constantly putting out social media and updating that. You can see they're very simple infographics because not everybody wants to read. And in fact, for you that have kids my same age as my children, they want memes, they want quick things, they want you know, the sort of instant gratification, having it all very quickly on that social media platform. But things such as when we've opened the borders, having some COVID-safe travel tips so that people are thinking about that as they're moving around. And that's our latest one there, update. So if you haven't heard the news, we are now able to stand up and drink if you're outside. And if anybody's organising a wedding, if it's 150 people and at a licensed venue, you are actually allowed to dance now. And that will stop quite a few emails into my inbox asking about that. But the other photo there is a very important picture, because it's when we set up a pop-up clinic for the Afghan community in the northern part of Adelaide. And so we can't just think that our general communication is going to reach everybody, and we have learnt from what's happened in Victoria the importance of speaking to our called community in an appropriate way. And Hussein, who's just standing in behind me there, has been fantastic. He's one of the Afghani leaders, and when we had the issue at Theberton and we had to put all those poor students into hotel quarantine, he was there that night until after midnight helping us with that, helping with the translation. There's actually two Afghani reporters, one does TV, one does radio, and they helped us get all our messages out. So I've got a team who's continued to work with other groups in South Australia, again, for hopefully we won't need it, but for shoring up the future here. The importance of partnerships. We've got national partnerships, local partnerships, private, non-government organisations, academia, and of course communities. Just the academic ones, I do want to say thank you to the universities who have provided us with medical students who have done a wonderful job contact tracing, and again, having partnerships with some of the researchers has also been really, really helpful. There's a number of important national committees, AHPPC, I won't go through it all, but being able to talk on a daily basis with the other chief health officers around Australia, again, learning, listening, and planning that together in a partnership has been extremely important. Here's a little picture of someone in the audience. This is Helen Chalmers. The other thing that has been very helpful in South Australia is that we have a networked health system. Now, I haven't worked in Victoria, but I certainly have colleagues there, and all of their hospitals work independently. And that's meant that they haven't been able to bring together a COVID plan the way we have in South Australia. And Helen has been instrumental in this, because she's running our acute stream and she's in contact with all the chief operating officers at all of the local health networks. So I've given you the map of our Adelaide local health networks, and then all of the country hospitals across our country local health networks. And so the plan that we had for COVID was that the Royal Adelaide Hospital will be the COVID hospital, and that is our current plan. And any patient with COVID will come in there, other than if it's a child, will be at the Women's and Children's, and if it's a pregnant woman, it will be coming to Flinders. And one of the reasons, well, the main reason we did that was actually listening to Bruce Aylward, because he said, if you have lots of different hospitals having these patients, you will end up spreading it more. And you need to have, and this is just a basic, communicable disease concept. If you have everybody with the disease in one place and you cohort them together and keep them away from everybody else, then it's not going to spread. And then unfortunately, in Victoria, of course, they've got so many hospitals, but they haven't brought them all together because they don't have that mechanism to do so. So I think even though we didn't have large numbers, and hopefully going into the future we remain like this, I think having this networked health system has just been absolutely important. And that will also stand us in good stead if we have outbreaks in our nursing homes, because our plan in South Australia is to transfer people into a hospital, and it's not for a clinical reason, it's actually from a public health reason. So because we know that in nursing homes that the spread can occur, and of course we have seen that unfortunately in Victoria. So the other thing that has been absolutely at the top of my mind is having good public health evidence. And again, this talk has a lot of photographs in it because there's a lot of people I work with on an everyday basis. And there's Paddy Phillips, and that's Carolyn Miller, who's at SAMRI. And so what Paddy set up and what Caroline has been absolutely amazing at being able to do is to provide me very quick turnaround times on evidence reviews. And these are some of the things that were particularly helpful. So should schools remain open? She's updated that 3 times. I couldn't have made the decisions I did about keeping kids at school without that evidence. And these do need to get updated all the time because we are learning more about this novel virus. The other one that has been useful recently was the COVID-19 transmission risk in entertainment settings. So I wanted to understand, did we have any evidence for standing up and drinking? What is it? It's not obviously alcohol doesn't give you COVID, but it's when you lose your inhibition from drinking and you tend to drift closer to other people, perhaps people that you don't otherwise know. So having that review of that evidence and being able to provide that to the other decision makers has been very helpful. The other couple is what precautions are needed to prevent a second wave. You can see why I'm asking these questions. But for an academic audience, I think you will appreciate the importance of being able to get this quickly when you're in that policy and under that sort of pressure. But it doesn't always go to plan. And even though I had the best evidence in the world at the time, this was the teachers' union. And it's just such a sort of, in retrospect, rather funny photograph with Seriously Spurrier, because that's what apparently my husband's teachers used to say to him all the time at school. But anyway, it was good to have a comeback and have that, to have that evidence-based report. The other thing that has obviously been really important across the board nationally is the contact tracing and being able to do a risk assessment. And this is actually a normal CDCB function. It's just that nobody else in the world knew that we did this on a regular basis until the pandemic. So we had a small team. It was highly skilled, very forensic. They always did such a great job. But you see that little picture there of the whiteboard and someone's hand? So that was how we were doing it. We'd get on the phone, ring up the case, we'd handwrite. This is the beginning of the year, mind you, at the start of the pandemic, handwrite all these notes, and then someone would have to manually type that into a database, and then they'd go off and whiteboard it. So I remember doing the whiteboard of the baggage handlers at the airport. It's pretty complicated, and it's messy. And so you either kind of do that, and then once you're overwhelmed because you've got more than 10 or 15 cases, you just give up. But we couldn't do that in this pandemic. So what we've had to do is really scale up, and we've gone from a team of about 15 up to more like 120, 150 people. So that means training people, onboarding, and then bringing people in and out to keep them trained. This little picture in the middle is a much more modern way. So we've worked with part of the police investigation unit to use their software so that now we can map clusters really quickly. Instead of using the whiteboard, we're now using, you know, this sort of more that, it's not really artificial intelligence, but it's that sort of technology to map. And you can see people are now taking they've got their headphones because they're now typing directly into software. So we have really, really improved our contact tracing. Of course, we hope we won't need to use it, but it's there because we need to be able to shore up the system if we do indeed have some more cases. And I guess I should say I am expecting to have some more cases, by the way, because we have not eliminated the risk. Now here, effective quarantine. This, of course, was a new concept for everybody. We were not used to, in a health system, setting up medi-hotels. And when we first started having these hotels, we were really concerned about the negative consequences because there's actually quite a vast literature around putting people into quarantine and what that does to them from a mental health perspective. And so John Brayley, our chief psychiatrist, was very much involved with doing this. And we have a focus on mental health and physical health for people during our quarantine period in our hotels. And there's a video for people that are travelling from overseas coming to South Australia so they can see what it's like in our Medi Hotel. And I have to say, I think Helen will agree, we sometimes wish we were going into quarantine. It looks pretty good. You know, your food's delivered, you can lie on the bed, you can watch the video. There's a picture of a lady doing her exercises and 2 weeks of that. But anyway, the reason behind the negative health impacts is because, of course, these people haven't agreed to be put into that situation. And it's that disempowerment of being put in a room and told you can't move and not having that choice. We have needed to quarantine significant numbers of people. Moving forward as well, when we first started, we were only quarantining those close contacts that we could ascertain by taking an interview. But as people have realised when we had the Theberton cluster, we actually quarantined not only the close contacts, but the contacts of the close contacts. Because this virus is very sneaky and the transmission can be quite rapid. And by the time we get to that stage and put a quarantine in place, it's already jumped a generation. So we're looking at faster ways of doing the contact tracing, and that's including some new capability with our software so that when we get a case, as soon as the pathology is notified, it gets SMS'd to the person, you're a case, fill in this survey, here's the link, and tell your close contacts to get themselves into quarantine. So we're trying to automate and speed up this so that we can get ahead of the game. So in terms of preparing the health system, this is a nice little quote from Dr. Ryu. A day later, the serum arrived by plane. There was enough for the cases currently being treated, but not if the epidemic were to spread. In reply to Ryu's telegram, he was told that the emergency supply was exhausted. Sound familiar, Sue? And that they had started to manufacture new stocks. So one of the things that was really evident at one of our first AHPPC meetings was that we didn't have enough masks. No way did we have enough masks. We probably used them up in the bushfire and what have you. But you know what? Where do masks come from? China. And where are they made? In China? In Wuhan. So, you know, we were really stuck and they were in the middle of like shutdown. So South Australia has been really, really innovative. It's not because I'm here or anything to do with me, but it is very innovative. And this is Detmold, who used to do food and they just turned over to medical supplies. With a partnership with the state government and health, we brought machines in and now we make these masks. And an absolute thumbs up for Flinders University because between you and UniSA have one of the first mask testing facilities in Australia. So again, this partnership and working and networking has been very helpful. So I haven't really been watching the time, I'm sorry, Jonathan, so I'll keep moving. You wanted me to think about this post-COVID world, so I'm going to end with that. It's not that COVID-19 has suddenly made the world uncertain. It's shown how uncertain it was all along. It's just that we haven't appreciated that. And Ryu says at the end of this book, indeed, as he listened to the cries of joy that rose above the town, Ryu recalled that this joy was always under threat. And he knew that the happy crowd was unaware of something that one can read in books, that the plague bacillus never dies or vanishes entirely, but it remains dormant. And it can come out at any time and cause a problem again. So that's what we need to realise in this post-COVID world. There are some wonderful silver linings from COVID. And Jonathan, I think you told me one of your, I think it was Alison, has written a list of 20 things that the university don't want to lose post-COVID. Here's a few things I don't want to lose. I love hand washing. I love it. It is one of the best things we can do. It was one of the first things I was taught about at medical school, that soap and water is much more important than any medication. And that's a little snapshot of our influenza this year. Well, where is influenza this year? It's that flat red line at the bottom. We have not had a flu season. Now, admittedly, it's because of some of the lockdowns and restrictions, but it's also because of the improved hygiene, and I don't want to lose that. The other thing I don't want to lose is this uptake of technology, the video conferencing. It's fantastic. It's nice that I've got people to talk to tonight, but the video conferencing is great. Telehealth. It was taking us years and years to get telehealth. I can see people's pained looks on their faces, but all of a sudden, you know, in a matter of a month, we got telehealth up and running. Not only that, we've got MBS item as well. You know, it's unbelievable. We've also got hospital at home, or home hospital, and again, that was something that was just seemed to be taking forever to get going, but we've now got that. Various types of point of care testing. You know, we've got our gene expert for COVID, and that's been working well. And as I said, the automation of contact tracing, it's fabulous. You know, just to modernise, we've just gone from like a 1980s version of contact tracing to something that you can be really proud of. The other thing is, for those who, I'm sure you're all interested in climate change, is that there's likely to have been this positive impact on climate change. So global emissions fell 10 to 30%. But one of the issues with this is that we could just go back to what we were doing before when we get our international travel going and such like, and it won't have made much of a difference. However, disasters often are the time of biggest change, and so this is possibly a turning point, so I don't want to waste that opportunity. Here's a lovely photo of an older Australian. Focus on older Australians. So this is something I don't want to lose. Like, this has really shown us with the nursing homes that we really have to do better about supporting our older Australians. I'm a paediatrician, but I happen to be on the Aged Care Advisory Subcommittee of AHPPC, because I just think everybody needs to have the care that they need at the right time in the right place. And so I was trying to find some photos of older people to put on this slide, and the nicest, oldest person I could think of was my mother. So there she is. And don't worry, Mum, you're not going into a nursing home anytime soon. The other thing I don't want to lose is the enhanced partnerships that we have developed in SA Health. Our relationship with SAPOL has been fabulous the whole time. There's a picture of Craig Patterson, who's been put in charge of the COVID response. And again, it's just been amazing. Same with the Australian Defence Force. I really had nothing to do with the ADF, and now I'm working with them shoulder to shoulder, and it's been great. The private health services, we have some wonderful partnerships now with private health, because we needed to when we're looking across the system in terms of our COVID plan. There's, with the education sector, sport and rec, there's a picture of me at the Adelaide Oval. I do know nothing about footy, except I have learned a lot, and I don't think I need to go to any more football matches. I think I've been to 3, and that will do me, quite frankly. You know, you've got the resources sector, primary industries, agriculture. See the little picture of the ram there? We were looking at exemptions for farmers to go and get ram semen. So there's all sorts of things I've had to come across since COVID. Tourism, arts and entertainment. I put the picture of the flautist there because, in fact, you might wonder about the orchestra, and now they're playing. What risk is it blowing out various wind and brass instruments? Most of them are okay, it's just condensation. It's the flute that is the main problem because you're blowing across. There's some other things that I would hate to lose in South Australia. Some of the new industries, business models, for example. We've talked about onshore medical product manufacture, but we gave some COVID Safe Awards, and see that guy there, he's got his hat, basketball hat on backwards and his iPhone stuck here. And what he did when we went into lockdown was he sells records. He has a pop-up record business. And so you would email him and he would do a video of himself searching, because this is what people who want to look for old records, it's actually the thrill of finding that record. It's not just getting it posted. So he would give you the thrill by videoing it. And we gave him a COVID Safe Award. The middle picture is the McLaren Vale General Wine Bar. What they did during the shutdown was when they opened up, they just wanted to open to groups of people, like known groups, family groups, rather than have a whole lot of different people in their restaurant. So they've done something called Dine Around the World. And in fact, I have a booking because I've missed out going to Tokyo this year with the Olympics. I have a booking and they're going to do me a themed Tokyo experience. You have the pilot come and give you an in-flight briefing, you get snacks. And so, you know, what a great idea. And they've continued to do that. So these great business models. Regional tourism has not ever been better in South Australia, which is great. And I've been told by a painter that I know that you cannot get curtains, tiling or painters in South Australia at the moment because all you guys were out there at home, working from home and thinking about your home renos. I wasn't, I was in the department, but there have been so many people now doing home renos, of course, not perhaps spending money on travel. This is also a great opportunity for public health because people have now, there's sort of community acceptance that such a thing as public health. We've now trained a new public health workforce and I'm hoping that we can focus and get some funding on prevention and population health. So in Australia, about 1.4% of our health budget is spent on prevention and on public health. Okay, most of it goes to Sue here. And it would be nice to see that adjusted because it's much better to prevent than end up in hospital. So I'm just about to finish reflecting on leadership in a time of crisis. So a couple of quotes. This is a beautiful quote. But I have to tell you this. This whole thing is not about heroism. It's about decency. It may seem a ridiculous idea, but the only way to fight the plague is with decency, not heroism. And then he's asked by Rampart, who's a journalist, what does decency mean? And Dr. Ryu said, in general, I can't say, but in my case, I know that it consists in doing my job. And that's how I feel about my role as a leader during this COVID crisis. However, it's always good to do it with a bit of style. So here I am, channeling Lady Penelope from the Thunderbirds to take you back. But the things that I feel reflecting on this is the importance of listening, observing, learning. I've talked to many people here as I've had this journey. Consistency, humility, compassion and kindness. And I said this at the beginning in some of my media, when there was a racism involved with this, there's no place for racism during a pandemic. Calmness, I'm not always calm, my family will tell you, but I am good at deep breathing. Trust, I've learnt the art of compromise, being a bit more flexible. Reflection, persistence, fearlessness, I am a very brave person, but also having a sense of humour. So I've come to the end, and I'm sorry if I run over time because I didn't look at the time before I started, but it has been an absolute pleasure describing some of my experiences this year, and thank you very much to the whole South Australian community because that's why we are in a good place. Thank you. I'm very touched, thank you.
So we are at just past 7:15, and if people need to leave or those online, then that's okay, but with your permission, we might extend just a little bit longer. And so we're keen to take any questions from in the room or on the online audience. And we'll go for about 7 minutes or so. Is that okay?
Yes.
Don't need to get back to the office by then? Great.
Oh, I've got a nice dinner.
So I have a couple of questions online, and we may not be able to get to all of them, but Nicola, you've described the fact that this is really, you know, a marathon or an ultra-marathon. Ultra-marathon. Can you talk about how you kept your team motivated throughout this period over a very demanding workload?
No, that's a really good question. And I think having a sense of humour has helped. Sometimes it's a bit of black humour that helps because you're making really difficult decisions. And the collegiality is also very important. So we spend a lot of time together. We're very open with each other. We care about each other. And I think people knowing that I've got their back and I know that my team have got my back, that's really what's got us through.
We've got a few questions, and you referred to it in your talk, around not just the health impacts, but the mental health impacts. Can you just talk about what the strategies might be from a public health perspective to ameliorate some of those mental health impacts?
So I think you've really got to look at what's the cause of those mental health impacts. And obviously for people who have lost jobs, that is going to be the reason that they are going to be feeling so stressed at the moment. And this is when we're making those decisions about lifting restrictions, was one of the things I had in my mind when we were talking about having the vertical drinking and the dancing for these particular venues, because that means that there are conferences and there are event organisers that can start getting their businesses back in order. So that's one part of it. The other part is not knowing what the future holds. So particularly for young people, and I've got a 19 and a 20-year-old, they are very concerned about, you know, are they going to get a job? They understand about this recession, you know, planning their future. So I think having a look at that side of it's also important. You know, I can't solve the economic problems, but certainly we need to have good mental health, but also mental well-being structures in place so that people can access counselling easily, can have somebody to talk to and talk through their problems. And I think, you know, South Australia and with our chief psychiatrist, we have made inroads to improving that sort of system for people.
So also, as you referred to, prior to this, nobody had heard much about public health or indeed epidemiology. How long do you think that interest in public health is going to last? Well, you know, I'd hate to say there's going to be another pandemic, but actually I think they're really, you know, in reality, we probably will at some point. And I think I'm actually always a very positive person. I suspect that there will be an ongoing interest now that the world's woken up that actually public health is important. Now, do we have any questions from the floor? Mark.
Nicola, thank you very much for both the speech and the work that you've done. I'm curious what advice you'd give to universities. How can we change what we do so that we're all better prepared, or that we're preparing our students or working with our researchers in some other way that you know, makes this easier next time?
So we could talk about that from actually the mental health perspective, and I have to say I'm really pleased that in South Australia we've been able to get face-to-face teaching back, because even though it's great to be having the video conferencing and being able to have lectures in this way, I do think it's important for young people to be able to come together and have that face-to-face teaching. In terms of going forward and sort of keeping in terms of the COVID space, I feel that we are going to need to live with a level of restrictions in place. So the hand hygiene, not coming to work when you're sick. So if you don't have policies in place for your staff to be able to take time off, that's an issue, particularly if you've got casual staff. So being able to have everybody the ability to not come to work when ill, I think is probably one of the most important things you can maintain.
Thank you.
So last question.
Thank you so much. You raised the issue of trust in science. And, you know, we have the most powerful person in the world probably who clearly does not trust science. I think in Australia we've done well, and in South Australia we've done well. Can we sustain that? And what are your strategies for going forward in maintaining public trust?
It's a real dilemma, particularly in the public health space, where you've got that prevention paradox, where you're actually having to ask a large number of people to do things for which they don't see they're getting any particular benefit. And so I was asked something similar by the media recently about what do you do when you've got somebody who says this is a conspiracy, and you know, and so I think if we bring it back to explaining to people that for the good of everybody to happen, you need to have everybody to work together. So explaining those sort of principles of public health that, you know, to improve the health of this particular individual, everybody will need to do something, and trying to bring people on board in terms of that community. Look, I think that the academic community can do a lot to educate the public so that when you've got that one particular leader who is saying things that are somewhat crazy, you've actually got an educated public. And so, look, there's a lot of things published in medical journals which I even have trouble, and perhaps you have trouble understanding when you're reading it, you know, to just cut to the core. So being able to communicate science, in fact, one of the things we'd early on thought we should probably get one of the science communicators on board, but it appeared we didn't end up needing that because we've got other media and comms expertise. But your university, I think, does have those science communicators, because I have to say I think there's more people in South Australia who now understand about incubation periods and contact tracing and such like, just because keep talking about it all the time. So I think it is informing the public and giving, and regardless of somebody's education level, if it's explained in a way that's simple, and you would know that with your own patients, that people understand. Yeah.
So, Nicola, on behalf of online and those in the room, thank you so much. There are a few things when Nicola was speaking which I just make a note of, which I think goes to not only what she said, but how she said it and the person that she has done and how she has cared for South Australians over the last 7 months. It's about people. What we've seen is authentic, humble leadership and a sense of decency. It's a team effort. It's heartbreaking. It's obviously personal. It cares. Public confidence, which is around trust. And also this notion of equity. No one left behind, talking about Afghanis, recent migrants to Australia, and about older Australians. So Nicola, well, Peter Radcliffe might have got the Nobel Prize, but he didn't get a standing ovation.
I can have the People's Prize.
Well,
much more important.
I think you have that. So please join with me in thanking Nicola again.
Thank you very much.